The stroke care in San Antonio has lagged behind the rest of the country for, I don't know, probably 15 years behind what people are doing across the country. There's never been a coordinated approach to taking care of ischemic or hemorrhagic strokes.
From the very beginning, we wanted a network. We wanted an organized system such that anybody in the community, no matter where they were within 15 minutes of a primary stroke center, a Baptist Hospital emergency department.
Brain and Stroke Network is an amazing thing. It's a collaboration that we put together between the Baptist Health System, the neurologists, the emergency department physicians, the ICUs, the neurosurgeons, and what it has allowed us to do is take care of stroke patients in San Antonio like we've never been able to do before.
The entire system, the 5-hospital system, has been able to establish teams throughout each hospital to respond quickly to stroke alerts.
We set a goal of 100 days for developing the Brain and Stroke Network. A pretty aggressive timeline, but we also saw the tremendous impact that this can have. And in fact, the day that we launched the Brain and Stroke Network, a patient saw the announcement, recognized that they were having a stroke, and got themselves to St. Luke's.
The next morning was Sunday. We were going to go shopping again. I got the Sunday paper, and there was a big article in there about the stroke network, and it had symptoms. One of the things was to put your arms out, and if one went down involuntarily, that was a sign. And as I was shopping in Walmart, my right arm and hand got heavier and heavier, and I started limping more on my right leg. And so I told my daughter, I said, if I don't feel better when we get through here, I'm just going to go to the emergency room and be checked out. I said, because I might be having a stroke, but I don't know.
We really want to educate our communities about the signs and symptoms of stroke, and then most importantly, what to do if one suspects they're having a stroke.
If you experience symptoms of stroke, remember FAST, and that's a facial droop, arm or leg weakness, a problem with your speech, and be very timely in getting yourself or your loved one to a hospital for treatment.
Nobody I'd known ever had a stroke. And I thought that was something that happened in possibly older patients, in their 80s or, something like that. And I was only 50. So and they kept telling me, well, you're young. And I said, well, thank you. That's the only thing I've ever been told I'm young about.
In terms of the endovascular treatment of stroke, the Brain and Stroke Network at the Baptist Health System is really the only team combined multimodality center within the city and really surrounding region in South Texas.
The concept of putting together all of the pieces here is an excellent concept in that it allows the neurosurgical services here at the Baptist to provide a unprecedented level of care, particularly as it relates to endovascular treatment of both stroke-related problems, aneurysms, and all types of problems that affect the blood vessels of the brain. This is a very high-end, state-of-the-art equipment that is being used by highly trained and highly skilled surgeons and endovascular trained individuals.
When we created the Brain and Stroke Network, it wasn't designed just to be the Baptist Brain and Stroke Network. It was in fact designed to allow other hospitals in the outlying regions to access those benefits of being a member of the network.
Telemedicine allows us to reach the rural areas because we're able to extend to them neurology and or stroke expertise and or neurosurgical expertise via the teleconferencing method.
What this combination of services has done is allowed St. Luke's to be really a hub hospital and accept patients who present with stroke at the surrounding network of Baptist Health System facilities, as well as surrounding even more rural healthcare facilities in South Texas.
Within the past year, Baptist Health System has not only created the Brain and Stroke Network, we've established ourselves in the community as a primary stroke center. In addition to that, because of our partnership with the University of Texas Health Science Center Neurosurgery Group, we've been able to build an interventional suite and also provide over 60 cases of intervention for stroke patients.
You know, San Antonio is a much safer place when it comes to having a stroke. Just a year ago, San Antonio was regarded as the largest city in America without an organized stroke center. Today, the Baptist Healthcare System offers 5 accredited primary stroke centers.
The past year has been very exciting for me. I've been interested in creating a stroke network for a number of years, and it's great for me to be able to see this come around.
I think that really historically it's been a banner year for both Baptist and San Antonio, and it's been very exciting to be part of that.